Hi class, it's our lecture time again. So let's learn some new things. Today we're going to talk about nonverbal communication. We're still in chapter 2, and here are some illustrations of facial expressions. And so when we're approaching our patients, we need to be mindful of our nonverbal communication. Our facial expressions can communicate to the patients how we're feeling, such as if we're frustrated, confused, happy, sad, angry, surprised. Okay. Also, our other body language. And body language can exhibit communication both positive or negative. Some examples of negative body language would be wandering eyes, yawning, stretching, tapping your pen, uh, sighing, crossing your arms or wrinkling your forehead, or frequently glancing at a clock or your watch, and even chewing gum. Here's some pictures of some illustrations of negative body language in the presence of patients: ignoring, seeming disinterested in what they're saying, having an aggressive posture, or an authoritative or power stance over patients. The lack of eye contact by the healthcare assistant, or in our case, the phlebotomist, gives the clear impression that he doesn't wish to engage with the patient. Also, the healthcare worker's body posture is not likely to encourage the person to think that this caregiver is interested in them or is willing to communicate in any way. So, what's some examples of positive body language? This is your body language that aids in communication, and it makes the patient interaction more pleasant, such as you leaning into the patient when you're talking to them and having eye contact, having face-to-face positioning with your patient, and then having your arms and hands and shoulders in a relaxed posture versus having your arms folded. So this is an example of good communication interaction between a patient and a caregiver. Bringing yourself to the same level is a powerful way to open up communication opportunities for people. So if possible, you want to have a seat, or in the case when you're drawing blood, uh, the posture in which you're leaning into the patient to draw their blood is a good posture of positive communication. And here we see an example of that, and you can tell that both the patient and the healthcare staff both exhibit, they're smiling and they're having a pleasant interaction. So let's talk about active listening. When you're actively listening to someone, you're giving them your undivided attention. You want to face the person that's speaking to you and just verify to them that you are listening and avoid judgments. You also want to provide feedback and maintain eye contact, and always be aware of your body language. Make sure that what you're saying is also what your body, your nonverbal communication through your body language is saying the same thing. Use encouragement, and then practice these things daily, because your nonverbal communication is a skill. Communicating with family, visitors, and significant others, and this could be very challenging in the healthcare setting. You want to patients when they come to the facilities, well, their caregiver and their families make them feel more secure. So you want to be mindful of them being there. And sometimes they can make unreasonable requests of you. So, in the case if that happens, you want to notify your supervisor before doing anything that you were not sent to do, okay? If several visitors are present in the patient's room, you may ask them to step out for a while you perform that venipuncture. Also, you want to be sensitive to the patient's privacy and confidentiality in the presence of visitors. You can't always assume that they want any of their information disclosed to someone else in the room, even though it may be their significant other or their close family member. They have the right to their sole privacy if they so choose. So you want to be mindful of that. And um, maybe when you walk into a room and you notice that there's family or visitors or that person's significant other there, you can ask the patient, is it okay to discuss your health information with you, or, reveal what, for example, what tests the doctor may have ordered or that you're drawing. And you don't want to reveal any test results or anything unless it's appropriate to do so. And in our case, we won't be revealing any results to the patients. So, what's the role of the phlebotomist in emergency situations? If you see the word stat, that means right now. Okay, that would mean that that's an emergency lab draw. If there's family or something in the room, you just apologize for the interruption and explain that you have an urgent lab to draw that has to be done right then. And then, depending on where you are, you want to make sure that families and visitors should not be permitted in the clinical laboratory area. Now, here's a big one, our bedside manner. This is very important because there's nothing worse than you already feeling bad and the person who's providing care to you has a bad attitude, or they're upset about something, whatever the case may be. If you whatever mood you're in, you tend to change the mood of that patient as well. So when encountering a patient for the first time, you want to introduce yourself and state who you are as a part of the hospital unit or the laboratory staff. Inform the patient that a blood specimen is being collected for a test that was ordered by the physician. Be calm and compassionate and highly professional. Caution the patient that the procedure may hurt a little, but will be over soon. And avoid any distractions by excessive talking. And then at the end, you want to thank the patient for his or her cooperation. Okay? And just always keep in mind to check your body language. And here's something to help us remember that, and it's aware. So you want to announce your presence to the patient. You want to welcome the patient to your facility and ask if there's anything that the patient needs prior to you leaving after performing your venipuncture. And that way, either if it's something that you can do for the patient, such as they may just need you to hand them something from the bedside table or from across the room, such as the remote or something like that. And you also want to review what was done and explain when the next service will be. And then always exit with a kind word. The first 30 seconds after the healthcare worker enters the patient's room determines how that patient perceives the quality of care offered by that facility or hospital. So you want to keep that in mind. You know, right off the bat, like I said, if you're feeling bad, there's nothing worse than having somebody come in and because of their demeanor or their attitude, it leaves you feeling even worse than you were before they came. So your assignment is going to be on page 52, box 2-3. Practice the steps 1 through 5 on controlling your voice and your facial expressions. And if possible, practice this with someone so that they can give you feedback. If not, you can do it in front of a mirror. And so after going through the steps, then tell me how you progress through the steps, or what feedback the person gave you, and what are some things you think you can improve upon. And I will see you guys next lecture. Bye-bye.